history.
How many kids or young adults do you know that spend countless hours competing to be the best at something they love? Well, it's human nature for a lot of kids, and for baseball, softball, and overhand athletes, they really don't realize how much stress they're putting on their arms. I would like to persuade parents to monitor children and young adults who participate in overhand athletics by providing information on the significant damages it causes on the shoulder and elbow, talk about the surgical procedures and other solutions, and lastly, tell my opinion and story on the road to recovery. The shoulder and elbow injuries have become more common in younger athletes due to the repetition and non-monitored throwing at a very young age. Monoloff mentioned that parents urge kids at a young age to be the best when they really don't realize what can happen to their shoulder or their elbow. There are many common throwing injuries, but the number one is the elbow, or the more intellectual name UCL, or ulnar collateral ligament. The location is the inside of the elbow, and it's sometimes known for its Tommy John surgery. Littner stated that the UCL is hard to tear because there's so many muscles around it that help to strengthen it, but it can be torn. The second most common injury is in the shoulder. It's a little more complex, so there's many different places that can be injured. The two most common areas are the labrum and the rotator cuff. The rotator cuff consists of 4 different muscles that keep the shoulder stable. The labrum is a little different. It's a cup-shaped rim of cartilage attached to the glenoid cavity that keeps the humerus in place and helps with stability. In Feely's article, he discusses the 3 types of tears, but the 2 most common in athletes are Bankart and slap, or the superior labrum from anterior to posterior. The labrum can be injured from either landing on it or dislocation, and the rotator cuff is more with repetitive motion. Now that we understand the damage that can actually come from unmonitored overhand throwing, let's analyze the different recovery treatments and surgeries that are used for these types of injuries. There are many different types of surgeries and treatments that help, but the recovery is not easy and the expenses begin to rise. The most common ulnar collateral ligament repair is Tommy John surgery. The breakdown is not really what many people think it is. For example, Owen stated that the doctor don't actually replace the ligament 80% of the time, but instead is taking a graft tendon from either the wrist or the hamstring and replacing the torn ligament. Owens also stated that Dr. Andrews mentioned that his research suggests that there's only a 75% success rate with Tommy John surgery. It's very true that younger kids are able to recover faster from the surgery, but it's our choice, or it's our decision to help them and not let them have this injury at this young age. And athletes should consider taking time off if they feel a little pain, because it could just be a slight strain instead of an actual tear. There are many people nowadays that are getting this surgery just for the velocity, just so they can throw a little harder than what they used to. The shoulder repairs most common in the labrum and the rotator cuff are the arthroscopic or traditional open surgery. The arthroscopic is recommended by doctors because it's an easier procedure nowadays, and it has a shorter recovery time so that the doctors can get you back out on the field. Feely pointed out in his article that he showed the procedure of arthroscopic surgery. There are 3 insertions. The first one is with a camera where the doctor can see what's going on, and the 2 other are just the repair objects that help reattach the labrum to the bone with sutures. The rotator cuff has almost the exact same procedure, but instead they're attaching the ligaments of the rotator cuff back into the bone. There are alternatives for this injury if it's not bad enough for surgery. Number 1, that's time off, and number 2, that's physical therapy for a couple months to help strengthen the muscles around. The therapy time is crucial. The recovery is 6 to 12 months and can be even more depending on the person and what their surgery consists of and how deep it is. Now that I've pointed out the alternative to fixing the shoulder or the elbow, I would like to discuss my story and opinion. When I was younger, I made my own decisions, decided that if I wanted to play softball or what other sports I wanted to play, and I decided to play softball almost year-round. I remember spending countless hours throwing and trying to get better. I was successful for a while until gradually I began to start feeling pain in my shoulder, and that's when about a year later, I dove and couldn't throw anymore, so that's when I had to have surgery on my labrum and had to have 7 sutures. The recovery was very hard, and the 8 months have not been easy, but for the love of the game, I keep pushing on. And one thing is, even though I did make my own decisions, my parents never did try to stop me from throwing a lot because they didn't know, and that's not a parent say, but when parents do know what can happen, they should try to monitor their children. We have talked about the significant damage that can be caused if not monitored or restricted, talked about the recovery and surgical treatments, and lastly, I discussed my story and opinion. If you have a young athlete that spends countless hours throwing or doing another overhand sport, I would suggest monitoring and or researching.